Okay, hi. Welcome to our milestone edition of our Facebook Live here on Thrive Moms. Our usual announcements. If you want to win our prize, which guys, I'm super excited about our prizes. We have some stacking blocks and this really fun ball today we will give out. We'll raffle off on Monday. And if you're interested, comment to us in the chat. Ask us questions. Monica is here with us. I feel like I'm screaming. Monica's here with us to talk to us all about milestones with our little ones and teach us how to play with them, because sometimes you're looking at your child like, what do I do with you? So that is where Monica can come in and help us. Thank you so much for joining us today, and enjoy.
Hi guys, I'm just going to take off my mask so you can see me talk a little bit. Hi, I am Monica. I am a nurse practitioner. I have formal training in neonatal nurse practitioner. I worked at Columbia and Mount Sinai, and I've joined the Valley Group 2019. And my job here is to follow kids after the NICU for their 2 years post-discharge to help you guys really get a good sense of where we are developmentally. So we celebrate the milestones that are happening at their chronologic age, and we discuss things that are happening at their adjusted age. And if there's something that we were expecting to happen and it hasn't happened, I help parents and kids get set up with the right therapies to make sure that we are optimizing our therapeutic support to make sure that we're getting where we need to go in those first 2 years, those really crucial years of development. So before we start playing, I really wanted to talk about this CDC milestone update that has a couple of people a little nervous because we are hearing that some parents are concerned because the milestones have changed or shifted and what that means for you guys. So in March of this year, the CDC and the AAP came together and released an update on their milestones checklist. I believe that the last time they did this was around 2006. And they did this not so much because children were developing differently, but because pediatricians and we are actually acting differently and responding differently to the milestones that we're seeing. So previously, what we had been seeing was that maybe about 50% of our pediatricians were really paying attention to and running developmental screeners and developmental checklists to mark where kids were in their development. Now we're seeing that almost 86% of pediatricians are doing this, and that's incredible. But what that means is that we now have more data and more support around what milestones should be happening when. So I just want to take a few minutes to review some of the changes that were made, because I know that this is a question that is asked of me a lot, and I want to make sure that we are all on the same page. Now, if this is just going to be an overview, if you guys have specific questions about a milestone related to your child in one specific point in time, I'm happy to guide you offline on this, but this could very easily blow up into a 5-hour discussion if we talk about specific milestones. What we're going to concentrate on now is what changed from a big standpoint and how it changed and what that means for you guys. So before this, there were a bunch of different tests and checklists and milestones, and nobody was really doing their due diligence to make sure that these tests were accurate, or were they consistent across every single test. So that means some tests would say you should respond to noise at 1 month, and some tests would say you should respond to noise at 3 months. And while that's not a huge difference, we wanted to make sure everybody was on the same page and really hone in on what that meant for us. So there was a lot of variability across tests. So we looked at, not we, they are very smart people over at the CDC, looked at a bunch of different screeners and tests, and then picked out 11 that they found reliable. So 8 experts had 11 criteria that they said, these are reliable tests. They are well researched, they're well supported. Let's look at these, and we're going to adjust our milestone expectations based on this new or this well-established research. The other thing that they changed was right now they do milestone check-ins at 12 months, 15 months, 18 months, 24, and 30. So they actually added a 15-month check-in and a 30-month check-in. Before, we had to wait a whole year between 2 and 3 to make sure we were doing a good job. And now we have that midway check-in, which I think is super important. The other thing that they did that was important was that they took out about a quarter of their checklists. And what that meant is they were looking at some of the things that they were expecting of babies and realizing that it wasn't necessary, or it wasn't well supported by evidence, or it was redundant. So what they did was they said, these aren't actually proving to show development. So we took out a bunch of them. And you'll notice that a lot of milestones were pushed off into the next age category. And that's not because babies are doing things later. It's because the previous checklist, they used an average to show the average age in which a child met that milestone. So let's say you have some kids doing things at 18 months and some kids doing things at 30 months. They said, that's an average of 24 months. That wasn't really promoting early action on milestones. So now with these milestones, the definition is if 75% of children make it by that age. So this is the biggest takeaway. The previous CDC recommendation milestones were focusing on the average age, and now it's when 75%, the majority of kids, are making it at that age. And the point of this is if we're not making that milestone, we want to act on it. We really want to eliminate that wait and see approach that we had previously done. So if a child wasn't crawling, let's say, and we're like, let's just wait and see what we're doing at our next visit. And if we're still not doing it then we'll call for a physical therapy consult. We really want to focus on if we're not doing something, we know the resources out there that can help us. So let's take advantage of those as soon as we see a problem. So this new CDC guideline checklist is really trying to focus on and promote early identification and really early therapy for any milestones that aren't being met, because we're hoping that then will equate to appropriate services and support to get those milestones back where they need to be if those are milestones that we're intending to meet. The other thing is that some of our milestones of the CDC checklist look similar to the ones that were in the last one, but what happened is that they now have proof of multiple sources. So before, a checklist item might have been just because one test item said, I want you to be clapping your hands at 6 months. But now, in order to meet this criteria, multiple sources needed to have said, we researched this and we know that this is the time that this is supposed to be happening. So when you see these switches in where the milestones are, it's because these 8 experts made sure that all of the milestones were well researched as best they could be. I think it's something like 80% of the final milestones have normative data from more than one source. So that's an incredibly reliable checklist, meaning every single milestone is supported by more than one document, more than one piece of evidence. Now, what does that all mean? Because that sounds like a bunch of medical stuff. So basically, all the pros got together. They reviewed all the tools that we currently use, and we've taken the most reliable ones and made sure that those are the ones that made it to our checklist. We made our checklists more frequent. So there used to be 10 checklists, and now there's 12 because we've added a 15-month and a 30-month. And inside of those checklists, there's actually a lot of evidence-driven data. And instead of being based on the average, it's based on when most kids are making those milestones. Meaning, if your child is not making a milestone at that time, we should be going and getting help for that. So it just makes it a little more concrete on what to do and when. So I think that a lot of confusion or concern was brought up when this first came out. But the real takeaway is that this isn't, and CDC milestone checklists were never a diagnostic tool. It was just a checklist to see if you needed to move on to a professional to have a diagnostic tool done. So if your child isn't making those milestones, that's the time that you come to see me, or that's the time that you come to see professionals like me, or a physical therapist or speech therapist, to then get a real diagnosis. These checklists are not for real diagnostic purposes. They're just a nice spot for you and I to take control together of our babes, to make sure that we are making our milestones. Now, if you're seeing stuff and you're like, hey, I thought we should be doing this by now and we're not, by all means come in. That is the whole point of me. My job is to make sure that your milestones for your baby are being met. And if they're not, we have professionals on board to help you meet them. So with that being said, let's start playing with some toys. So if you ever came to my office, you know that a lot of what I do is playtime. And that is the way babies learn in their first few months of life. So we're going to talk about some stuff. Now, my toys come from our diagnostic tool. We use the Bailey scales of infant development here. So my tools are, and my toys are non-branded. But I will tell you some of the blocks that I use, because they're wipeable and I love them. I would absolutely use those Melissa and Doug blocks, the Melissa and Doug stackers. They're great. All of my stuff has to be wipeable, so I can't have the fun wooden stuff here. But I'll tell you kind of how and why I play with stuff and what milestones we can do. So the first thing we're going to do is blocks. And I will tell you, those toys that have a lot of automatic feedback, so the things that light up and have noise and your baby doesn't have to do things to make that happen, although those are a lot of fun, they're not great at promoting development, meaning they can absolutely entertain your child and they can be fun so that you can get a load of laundry in. But toys that are just doing things to do things aren't promoting cause and effect in your baby's brain. It's not promoting cognition. So when your baby first gets home, our first milestone is going to be alerting to sound, and it's going to be lifting and turning head and a belly. So when your baby is laying on a belly position, sometimes during diaper change, or if you're doing skin to skin, or if you're doing tummy time, that first milestone I love is when that baby takes our head and lifts it off the mat. That's a nice 1 to 2 month milestone. It makes me really happy to see that. Another thing that I love is a baby alerting to sound. So this is literally, that's it. This is all we need. We don't do anything fancy here. Just a little bit, not too loud. And your baby will not look at these things till about 3 months, but they will alert, meaning I'm sitting here and I don't care, minding my baby business, and you ring this, and all of a sudden I go squish my face. Or I open my eyes like, what was that? That's a really nice 1 to 2 month skill. I only start to look at things around 3 months. I look at you, mommy and daddy, at 2 months. So a great, wonderful, beautiful thing to do with your babies in the first 2 months is hold them about 18 inches away from your face after a feeding or before feeding when we're nice and alert, and just talk to them. Talk to them about nonsense. You can read your textbooks to them, but you just talk to them with a nice cadence, a cadence that sounds like how you would like to be spoken to. Baby voices sometimes, not baby voices all the time. I'm really guilty of that. I know better, and still I'm like, and I love you so much. You can do it, it's fine. But those are nice 1 to 2 month milestones. Now, once we start getting into those 3, 4, 5, these are the like exploratory milestones, meaning our play is not functional play. We're not playing with blocks to be blocks. We're playing with blocks because they are hard, they are square, they are cold, they're just sensations to us, so we're exploring them. So I love these blocks. I also love the blocks with the little animals on them and the little shapes on them. So at 3 months, a great 3 month milestone is if you can put this into your baby's hand, they will curl their hand around it. And it's a nice little neurologic curl. At 4 months, they'll grab it and they'll start squeezing a little bit. 5 months is a palmar grasp, meaning we're really going to try to hold on to this. 8 months, a grasp like this. 9 months, we're going to have a finger grab. And by 12 months, we'll have a nice 3-jawed chuck on our block. The other great thing about this is your baby's brain and development thinks they have one little hand. So to promote thinking and knowing that we have two hands around 6 to 8 months, we can try to put two objects in each hand. Now what will happen at first is when we put an object in your baby's hand and present the second object, your baby will drop that object and grab for that new object, even though we had a free hand. Around 8 months is when they start to realize, oh my gosh, I have two of these things, and I can pick up a block in each hand. So these blocks, even though they're very simple, can be used from 3 months all the way through. Now, 8 months, this is teaching us that we have two hands. 12 months, we attempt to stack two blocks on top of each other. Attempt. So that means that we're going to take this block and we're going to come in 60 miles an hour and smash the other block, and nothing's going to stay. Around 14 months, we have enough control to actually stack two. Now, if this isn't happening perfectly, that's fine. Some children are maybe developing their language skills, or maybe they're doing more gross motor stuff. But these are toys and things that we can play with to kind of promote these different types of developmental milestones with the same toys. So you don't need to have FAO Schwartz in your backyard. You don't need to have, all these toys. This one toy is going to last you through 14 months pretty well. The other thing that I love is a cup. I swear. So if you take these blocks and in and out of cups, this is object permanence, meaning a younger child is not going to realize that their blocks are in this cup. Around 7 months, we can practice helping them release this block into the cup. They're going to think it's great. You've spent $0 from 3 months, and now your child thinks you're a magician. Around 13 months, you can take them out, and the child will want to put in and out. This is going to be the most fun they've ever had. And it's not for a lot of money. And we can reuse these blocks, and you can see how we went from exploring to goal-directed play, and then to really imaginative play, because these same blocks at 18 months, you can build up and make a baby T. You can make a choo-choo train. And these are the things, I don't know how many of you have come to my office, but these blocks are used almost every single visit in different ways for your child's different stages of development. So at the end, when we are 2 years and you're coming in for your final exam, we're pretending that this is a choo-choo train. We're pretending it's a fence. We're pretending it's stairs. And these same blocks can be used to do executive functioning, choosing. I also use them to practice understanding the number of them. Can we count them? Can I have just one block? And then I hold my hand out, and your child gives me one block, and then another and another, but we sit and practice and say just one, not two. So all of these blocks are used in almost every stage of this early development that we play with. The next thing I want to play with. Now, Manhattan Toys makes a very cool version of this. This is my wipeable COVID version. It's not fun. So this is a ring toy. I first introduced this toy around 2 to 3 months. So at 3 months, when your baby is sitting, what I hope for is sitting with their hands down or hands up close to midline. I want us tapping this ring on their hands, and I want to see some activation towards stimulus. Now, in the beginning, that activation towards stimulus is going to look ridiculous. You're going to tap their hand, and their hands go out to the side or nowhere near the ring. And you're like, oh my God, what happened to my baby? Nothing, that's normal. So as we get more mature, I want that baby to then try to bring these hands to midline. And this ring is going to help each hand grab the side of the ring and promote midline, especially if your baby was born early. A lot of these muscles in the back and the chest are tight in a way that makes midline really hard for them to do on their own. And I'm sure that your physical therapist is going to help you with this. But from a developmental standpoint, I really want this to happen, and I really want you to be midline because I want there to be a hand-mouth-hand transfer around 5 months. Meaning, I have this thing in my hand, I bring everything to my mouth around 5 months, and what this does then is that it helps my hands practice hand-mouth-hand transfers. And then at 7 months, that's just going to be a hand-to-hand transfer. And that's going to help us figure out that we have 2 hands. So it's the same idea. All these toys work together to promote this cognitive function and this pathway in our brain to help us figure out where we live in ourselves. So I love the toys that have a bunch of different rings, the ones that have tighter ability or wider ability. Based on where we are, we can hold them way out here as a baby, or we can hold them super tight. Or if we're not really great at at grabbing at midline, even if we miss grab and we have one up here, there's a chance to grab it. So I love those ring toys for exploration. Another toy that I love, this is really, it's silly, but this ball has a bunch of different spikes on it. For sensory development, if we have a kid that is really sensitive to touch, a child that has a really hard time calming themselves, this is a really great toy. You can rub it up and down their arms. You can have them tolerate holding this ball because this is something that's mildly uncomfortable without being painful. So we're not hurting the baby in any way, but if we have a kid that startles very easily or is very sensitive to the environment around them, I love running this up and down their backs and their arms and their legs. It also helps them figure out where they are. So if we have a baby that's 4, 5, 6 months and we're just starting to figure out where our feet are, because that's the time when we start to grab our hands to our knees or our hands to our feet and start sticking our feet in our mouths, rubbing this up and down their legs and their feet, or having their hand with this in there so they can feel it, having it touch their feet or touch their knees. This is a really fun way for your babies to kind of wake up and feel the stuff around them. What else can I want to play with? I want to play with these rings. So stacking rings is going to be an older developmental tool, and people are like, oh, my baby is too young to play with that. This is not true. So these stackers are wonderful for exploration. We do a sloppy stack around 12 months, meaning we stack out of order. We stack like a crazy person. I want this also to be one of these things that we are then manipulating multiple objects. So hoarding, swear, is a milestone that I excel at personally. But what we really want is for a child to look at these toys because they are light and easily manipulated. We hold one around 8 months, and then we hold 2 in our hand around 9 months because we want to grab this third one. So having 2 objects in one hand and a third in another is a really nice 9-ish month milestone. Once we hoard and tuck, we can start manipulating in our free hand. So this is a beautiful 15-month milestone. So these toys, before they become functional, are really good for play for those younger ages. So if you have, let's say, siblings, and one's a little older and playing functionally with this, that doesn't mean that the little one can't come over and play and explore too, because these are super fun toys that last through a bunch of different milestones. Stacking is super important. It's eye-hand coordination. It is fine motor skills, and it's also a motor plan, because you will notice that these kids at first are going to be all over the place, knocking this over, very frustrated. As they get older, this is a simple motor plan that when you do it, it is an immediate feedback that this is fun. I have these different colors. Everything felt different. The one that I love is that Melissa and Doug, because there's a circle, there's a triangle, there's a square. So this also practices sorting. It practices colors. There's also shape differentiation that really comes around 18 months. So these toys really last the span of your milestones without you having to break the bank and buying 600 more toys. Although, if you saw my playroom, you'd be like, you are a hypocrite. I am. Okay, this other peg puzzle. This is a very simple, very effective tool to start playing with for the entire milestone. So I'll show you the pegs that come with it. Now, it doesn't have to be this particular game, but anything where you're putting pegs into a pegboard. So around 4 months, again, we have a sustained grasp, meaning if I put this in your hand, you're going to try really hard to squeeze onto it. 5-month palmer, again, 8, 9, and then we have our 3-jawed chuck at 12 months. These pegs are really important because they help our hands get ready for coloring, and they help our hands get ready for handwriting. So when we play with these now, even though your child isn't anywhere near cognitively ready to color, that's around 18 months, sometimes earlier, this helps their hands get ready for that. So when I see kids place this peg into this pegboard, the first thing I see is a palmar grasp. So that's like if our child were coloring, it's this, violent scribble that we do. Around 12 months, we get a 3-jawed chuck. Sometimes we'll get a finger that comes out, and this is going to be our handwriting grasp. So this is perfect for that. So inserting and taking out repetitive is a nice 13-month skill. Putting one in and then taking your finger and exploring the other holes to be like, how did that happen? That's as early as 12 months. So this toy is doing stuff and helping you from 4 months all the way through 18 months. It's helping with handwriting. It's helping with object permanence. It's helping with our fine motor and our motor planning and also our exploration. So toys like this really stand the test of time. By the time you're with me, I actually time your kids to make sure that they can get this done within 25 seconds at one of my developmental exams. So if you think we're just playing, this is real-time stuff. So this is very helpful. Also, what we do with these, if you have multiple colors of them, I love color sorting when they're older. It takes them to an extra level. So we put 3 cups out, and I ask you to put all the yellow ones in a cup, all the red ones in a cup, and all the blue ones in a cup. It's nice because sometimes color labeling is a different skill than color matching and color sorting. So if you ever see me play with these ducks, sometimes I just say, what color is this duck? And you can say blue duck. Or sometimes I say, which is the red duck? So your child has to then label the red duck. So if you have these toys, it doesn't have to be ducks. If you have 4 or 5 monster trucks in your house and you can line them up and ask, which one is the orange car? Which one is the red truck? That way your kids are practicing labeling the colors. Another milestone, which is just a hair older, is which one is the big duck? Which one is the small duck? Using describing words in any toys that you use, it's going to be really helpful for this child, your child, to expand their language. So instead of saying, get me the duck, can you get me the yellow duck? Can you get me that small yellow duck? That way, these describing words help reinforce both size, color, distinction, so that when they're describing things in their mind, when they're making these connections, it's not just a duck, it is a big blue duck. And these are more mature milestones, but when we play with our babes, we want everything to be with a purpose. And that's super important. So we're not just shaking this rattle to shake the rattle. We're shaking the rattle because we want our baby to alert. I also don't want you to do this 6,000 times a day. Your kid's going to be nuts. But at 5 months, when I have this rattle, I'm going to take it off midline because at 5 months, your child tracks it. At 7 months, your child can track vertically. So when we're doing these are things to promote cognitive development. When we're playing with these toys, to take them off midline, so your child has to rotate their body to then engage in this toy, that's going to promote gross motor development. So these are just certain toys that I think are super important to last through our milestones. I also love answering the question, hey, Monica, I have this toy. What do I do with it? How am I playing with my baby? What toy? My baby is 3 months old and not looking at this X, Y, and Z. What am I supposed to be using? If you have any questions about toys or development, I want you to reach out to me. I'm available here at the center. I'm available however you can get your hands on me. Danielle will come find me.
So first of all, are you brilliant? You're absolutely brilliant. That was amazing.
Thanks.
But yeah, moms, ask questions. Now is your opportunity to ask Monica some questions. What are some favorite things that your babies do? I have a question. What do you think about bath time? Because I feel like bath time is such a great opportunity for play.
I love bath time play.
I just don't know what to do. And I mean, my kids are older, so I have a 3.5-year-old and a 1.5-year-old.
Mm-hmm.
But even so, when they're little, I feel like bath time is a great opportunity for play. Talk to us about bath time for a little bit.
I love bath time. Okay, so bath time is a great opportunity, because the sensation of water is phenomenal. I love the cause and effect toys sometimes. If you've ever seen them, they stick to the wall and you can pour water in and they spin. I mean, that can be a whole 30-minute tub time. I love there's crayons and markers that you can mark on your tub. I really suggest cleaning those off right after. You're going to have orange marks on your tub forever, like me. But that's great for handwriting grip and being able to make mistakes. The whole point of this is to make mistakes without worrying. So when you drop that toy, it's not good forever. It's just right there. I love a good cause and effect. I like throwing things into the tub next to my kids to watch them splash. Then subsequently, when they throw them out of the tub, I can't get mad because it's my own fault. But I do like taking those rubber. I had this farm rubber ducky set. It was like a little rubber cow and a little rubber pig. And we talked about the pigs and the cows. We talked about their colors, their sizes. And then we would do bye-bye cow and push them into the tub. bye-bye pig, and push him into the tub. So it was fun. It was engaging. Then we labeled all the animals, and then I would say bye-bye, and I would wait. And then duck, bye-bye duck, because he wanted the next one to splash in. Bye-bye cow, bye-bye cow. And then he'd push it in. So it was a nice, easy cause and effect that really promoted language. It promotes, sensory development. It's a lot of fun. So rubber ducky, farm animals or whatever your kid is into. So like my child's obsessed with farm, but if your kid's obsessed with trucks, cars, princesses, I know that Disney makes a bunch of princesses. Bye-bye Snow White. And Ariel wants to swim, Sleeping Beauty wants to swim, whoever, and the cause and effect is very tactile in the tub. It's a lot of fun.
Amazing.
Thanks.
Amazing. That was so